Managing intraop macular hole with autologous retinal graft. We present a case of routine vitrectomy planned for vitreous hemorrhage using 23 gauge on the Constellation machine. We start with the core vitrectomy to clear off the central blood-filled vitreous, so as to get a glimpse of the retinal details behind. We clear up the peripheral vitreous skirt in all quadrants to the maximum extent, being a phakic eye behind, careful not to cause a lens touch. After having a good retinal view, I use the cutter to gently aspirate the residual pre-retinal heme. The patient moved and the cutter peeled retina, creating a macular hole. At this point, my heartbeat is racing like a Ferrari and I am thinking on what to do next. All is not over yet. I use the flute needle to aspirate the rest of the pre-retinal heme and to assess the size of the inadvertent macular hole created by myself. It appears to be around 1000 microns in size, as a rough estimate. Not losing my faith, I plan on filling the macular hole with a retinal autograft and do a localized cautery at the harvest site in the supratemporal quadrant. I barrage the area of autograft harvest with endolaser in 2 to 3 rows. I use the finesse flex loop and peel of the retinal tissue on the all sides of cautery to obtain a full retinal tissue. With the help of the intraocular forceps, we gently scrape the autograft tissue. Using the intraocular forceps, I gently fill the inadvertent macular hole with the autograft tissue. The retinal graft appears nicely well fit in the macular hole. Fluid gas exchange was done using a 23 gauge flute needle, and fluid gas exchange was done with 14% octafluoropropane. At 6 weeks post-op, the retina is well settled with the autograft filling the macular hole completely. No graft complication was noted up till 3 months. The visual acuity pre-operatively was finger counting 1 meter, and post-surgery was 6/24 on a Snellen's chart. Conclusion. 6-week post-op shows a well-centered retinal graft. Optical coherence tomography shows fovea thinning with a closed macular hole.